Boston organization helping dads connect with their children by addressing systemic barriers in mental health. Erica introduces us to a father who, after years apart from his daughter, found the support he needed to form a lasting relationship.
This room right here is the...
It had been over 5 years. All he got was 15 minutes. He savored every second.
2.5, 3 feet bigger than what she was the last time I seen her. The most beautiful looking kid ever. And it was just a lot, you know. I cried.
Lorenzo King sharing the experience of reuniting with his daughter. Born when he was 19, a breakup with her mother and hard times followed. He reintroduced himself with love and an apology.
I'm sorry that I've been away for some time, but she had a few questions. I answered them, and the main thing that we did is we read books for the first 3 sessions, so that made it a lot more comfortable. We colored a few papers. I'm sorry, I'm getting a little emotional. The day was just a lot.
He credits Dr. Charles Daniels for making that day and many happy more in the 3 years since possible. A father himself, raised by a single mother, it was in graduate school when Daniels started a support group at the Dimmock Center. It changed his perspective on his own childhood.
If your father is absent, that means that your father doesn't care about you and you are not worthy of his love. That was the assumption that I made. But those dads completely dismantled that assumption. They loved their children. They were struggling with a substance use related issue, depression, anxiety.
The idea for Father's Uplift was born. The nonprofit provides coaching, therapy, substance use treatment, and countless other supports.
Poverty, that fight with mental health, that fight with substance use, right? That fight of just trying to pick up the phone. Shame, guilt, and embarrassment will make that phone 200 pounds. Dad struggled with picking up the phone. I want to tell that story. It's not talked about enough.
In many cases, he says it's a vicious cycle. Kids without a father so often struggle and then repeat the behavior. That was the case for Lorenzo, who entered foster care at 13.
Currently, we know that there are roughly 5 million fathers that see their children less than once a month. These are fathers to at least 10 million children in the United States today. There's no dad dreams of being a deadbeat. We have to do a better job in making fathers feel important. I'm talking about the dads that really struggle, even dads behind bars that are struggling to stay engaged in their kids' lives.
Learning how to navigate the court system to be granted visitation is part of what helped Lorenzo. He now mentors other dads.
Any father out there who needs help, who hasn't seen their kid, who feels like their family is breaking up, Father's Uplift is here, and we're here to help.
Father's Uplift is the country's first mental health and substance abuse treatment facility for fathers and families, and we're so happy to have Dr. Charles Daniels. He's co-founder and CEO of Father's Uplift with us today. Thank you for being here. Let's start with some follow-up. How is Lorenzo doing?
Lorenzo is now a graduate of Father's Uplift. He's an entrepreneur now, so he started a business working with dads, giving back what he received from us.
That's great. That's great news. So it's great that you have people who have used the supports of your program now working and to help others talk more about the programs. But why don't you tell us about some of the other programs that you run?
Absolutely. So with the therapy, we provide fathers an opportunity to really explore their emotions and stay engaged in their kids' lives. Any barrier that prevents them from being engaged, we address that in therapy. Coaching, issues pertaining to navigating child welfare, child support issues, housing, substance use. We believe that those services combined makes a huge difference. And as of recently, we want to give back what we receive as a result of generous donations and support in the state of Massachusetts. We create a fellowship for future therapists, BIPOC therapists, to get acquainted to becoming therapists in the field and work with men and families as well.
That's great. So many things to overcome, and it can be challenging. We have some statistics here. According to data from the Prison Policy Initiative, 67% of incarcerated people are more than 100 miles away from their family. 2/3 of incarcerated parents with minor children never receive a visit from those children. So how does this lack of access affect fathers and children, and what can be done to address this barrier?
Absolutely. So when you hold your child in your arms for the first time, there's a love, there's a smell, there's that commitment that I'm going to always be there regardless of what happens. Now imagine that being taken away from you in the blink of an eye, right? The mental health concerns that leads to, the struggles,
the
right?
guilt.
The guilt, the shame, right? No father wants to be absent from his kid's life. So when we think about how that impacts them, it impacts them mentally, it impacts them physically, it impacts them emotionally. So we want to make sure that fathers can get reconnected to that, because it also serves as a source of motivation, but also you have something to live for when you have your kids in your life. And that's one thing that every father wants to experience, even though they may not be present to experience it.
You know, we've talked about the challenges of finding therapists of color on our program in the past. According to the American Psychological Association, 88% of psychologists in the U.S. workforce are white, 5% were Asian, 5% were Hispanic, just 4% were Black or African American. And you started a fellowship program, as you mentioned earlier, to kind of address that disparity. How are you doing that?
Absolutely. So we're giving 14 amazing BIPOC students a $15,000 stipend and access to the knowledge of how to start their own practice so they can go back to their communities and make a difference. We want to give a shout out to the Department of Public Health for giving us enough resources to be able to do that in the state of Massachusetts. But to make a long story short, these kids need the resources, but they also need the know-how. And they all want to be entrepreneurs and open their own practices. So we're going to give them the tools to do just that. And that's the part that we play in creating more BIPOC therapists for future generations. We can't do it by ourselves. We need them. We got to teach them everything that we know.
But you know, sometimes there's such a wait for social and mental health services. Do you have any drop-in programs for men that need help immediately?
Absolutely. So we have a weekly drop-in group that occurs every Wednesday at 4:00 p.m. So all you got to do is call our office, reach out to us. We'll send you that Zoom link. But you can come in, tell us what you need. We also have a fund where if you need a bill paid or whatever you need, we can take care of that for you. But stop by. You don't have to be enrolled in our program. We have that weekly.
Great success story. Listening to Lorenzo, can you share with us another person that you've helped that really touched you?
Absolutely. So I want to shout out one of our fathers, George, who came to us really down and out, was waiting for a heart, and he was separated from his child who was in Pittsburgh. But I'm proud to say that now George has his heart, but he also has his daughter back in his life. He has a business that he calls the Boat Group, where he designs clothes for and also can provide personal consultation. So reach out to the Boat Group. Also give George a call. You can Google him, but you also can reach out to us and we'll connect you to him. But he's a great guy all around. He's a dynamic father, and he's also someone I admire. It's hard to fight for your kids while you're waiting for a heart transplant, but George did it. He's a walking testimony. And now he's the man that I wish I was half of that.
All right.
Yeah.
All right. Thank you so much, Charles,
Thank
for
you
being
for having
here.
me.
We're so grateful for all the work that you're doing to help fathers and their families. And again, thank you so much.
Thank you.